Camera. Oh, thank you. I forgot to say that we were about to be recorded, but now we all know we're being recorded. So Clare Cameron is Professor of Social Pedagogy at University College London. She's Deputy Director of the Thomas Coram Research Unit there. And she's a sociologist interested in childhood education and care, comparative research. And she is my co-lead for Healthy Livelihoods within the UK Prevention Research Partnership funded Act Early project, and so a much valued colleague. And Clare is going to talk to us today about her research in Tower Hamlets. So Clare, I'm going to stop sharing my screen and ask you if you can put your screen up and invite you to talk to us about your research. Thanks for joining us.
Hello everyone. I've no idea how many of you out there, but very happy to be with you this afternoon. And thanks, Kate, for the introduction. As she said, I'm Clare Cameron. I work at the UCL Social Research Institute, and within that, the Thomas Coram Research Unit, which is located in the Institute of Education at UCL. And I'm going to talk today about a study that we've been doing in Tower Hamlets over the course of the pandemic. So we started last June, and it's going on until the end of December this year. And I'm going to also talk a little bit about a parallel study that's been going on at the Bromley by Bow Centre, also in Tower Hamlets. So, what the aim of the study really was to examine what was going on for families with children under 5, and we took quite a broad view to that. We were interested in the social, the economic, and the health impacts of the pandemic on children, well, families with children under 5 and pregnant women. So far we've done a survey, which we call the Wave 1 survey. That took place last year between July and November. It's very much in cooperation with the borough. They did a lot of the help with finding the sample, and we're working quite closely with the public health team, the child health teams, the early years teams, the anti-poverty team, and so on. We had a £10 reward for participation for that survey. And then we followed that up with a household interviews. We're looking at 20 households in total. We've done 17 so far, and up to 3 members, adult members of each household. And we've done 29 interviews so far. So that's, I shall be reporting mainly on the survey work, not on the qualitative work today. And the Bromley by Bow work did an Act Early project, which was about what makes the best start in life through a lens of challenges, dreams, and changes. And they did an online survey and lots of community engagement activities with about 570 families. And I'll just, the findings from the 2 studies are very complementary. So I'll just bring in some of their findings along the way. Okay. Yeah, participants. We've got 870 participants with children under 5, 62 of whom, 62 addition were pregnant, and 60 were both pregnant and had a child under 5. We've got a sample that we're very proud of because it represents pretty broadly the ethnic breakdown in the borough, which is 34% white British Irish, 36% nearly Bangladeshi, and 30% from a wide range of other ethnicities, including Somali, Black British, and Indian. And that is slightly more Bangladeshi and slightly more white British than in the 2011 census, but pretty much spot on. Of course, those proportions may have changed by the 2021 census, but we'll find out that in time. In the family playrooms work, that they were a similar group, households with children under 11, 80% women, and mostly Asian British participants. And I've got a banner that keeps on going across my slides. Okay. So the next slide. Okay. So the first thing to say really about Tower Hamlets is that it is a really unequal borough. It has a lot of wealth, in particularly because it has Canary Wharf in it, but it also has some extreme poverty. And if we think that the national unemployment rate in 2019 was 4.5%, unemployment in Tower Hamlets rose from 33% at the beginning of the prior to the pandemic to 40% at the point of completing the survey. That is an extraordinary amount of unemployment. And particularly overrepresented were the Somali groups and the Bangladeshi groups in those figures. And the employment profile of the Bangladeshi community has always been more male workers, particularly in more precarious jobs, and fewer women workers than would be found nationally. So this is really a big push towards unemployment and precarity among the Bangladeshi group, as well as everyone else. So not surprisingly, 2/3 had some kind of income support benefit. And there was a big increase in the number of people claiming universal credit. So by the time we did the survey, there was 26% of Bangladeshi and 41% of Black respondents were claiming universal credit versus 16% of the white British respondents. Income, the bottom I've put the income profile, we divided into the 3 groups. It's interestingly enough, the average income in the borough, according to national statistics, is a little above the national average. But when you look at the survey respondents, there was 22% had 52K or above as a household coming in, and 32% were we put into the medium bracket, and 39% were in the low income bracket. So of course, our sample doesn't quite profile the incomes of the entire borough in terms of proportions, but we do have a big range of income represented. And on the right, you just see the more detail about the rate of unemployment. So unemployment goes along with a high degree of food insecurity and money worries. So these are just a little bit of a snippet of our findings, really. 22% of respondents had used a food bank recently in the last fortnight, and 25% had skipped meals. And I think Kate can probably tell us how that compares with the Bradford groups, but I think it is considerably higher than the Bradford responses, because of course we used many of our research questions came from similar surveys run in the Born in Bradford group of studies. So on the right, I put a couple of the comments about money worries, not having enough money to even buy food for myself or my child and having to ask friends for money, and worries about providing food for my children as work cannot provide overtime due to COVID-19. So just a little glimpse of the ways in which unemployment meant quite serious concerns about surviving. Housing. In the national sample, I think it's the case that 2/3 of us own our own houses with a mortgage or outright, but this was reversed in the case of Tower Hamlets, particularly among the non-white British sample. So you can see that the renters are particularly among the Asian Bangladeshi community, the Somalis, the other ethnic group, and even among all respondents, it's 56% were renting. Quite high proportions also needed major home repairs. 20% had damp or mold, particularly among, again, Bangladeshi and Somali families. 17% were in one bedroom, and this is a families survey. So nearly all of the participants had 3 people in the household. Quite some had 2 if they were single parent and 1 child, but most of our group had either 1 child and 2 parents, or 2 children and 1 parent, or 2 children and 2 parents, or more. So for 1 bedroom, there's quite a lot of crampedness. Hardest part, as one said, is we are suffocated in our home. We live in a 1-bedroom flat with 6 of us. There is nowhere to relax, play, sleep, eat, or do homework for me. and my kids are suffering big time. And I think this is an area, housing quality and space is an area we are exploring further in our analyses, because it's really quite a big impact of living with the pandemic is just being squashed. Environment and space came up a lot in the Bromley by Bow Centre work. Actually, that 49% had access to outside space. That was in our survey. So only half of the children in the survey had anywhere outside just to breathe, really, without leaving the premises. Another one said, living in a flat with no garden is difficult. It feels like a prison due to limitations and restrictions. From the Bromley by Bow work, one person said nurseries are too busy and too small with very little outside spaces for kids to run and get sun or vitamin D daily. The parks and grass are super dirty and not safe for babies and toddlers. So not surprisingly, one of the biggest challenges was simply staying indoors. When we turn to access to health services, the borough service providers in child health and midwifery and so on told us that they were maintaining a pretty much full-on service, in that they were accessing over 90% of mothers in antenatally or postnatally through digital means. But that wasn't really the experience of our participants. Only 75% of those who were pregnant said that they'd had access to routine midwifery services, and that was less among the Bangladeshi group and the Asian other group. And one father said, under his worries about the challenges about living with the pandemic, he said, wife have birth, getting to the hospital, having to leave after the birth with baby in ICU, not being able to see them for days. These kinds of restrictions were hard. Again, new baby checks. The borough says that they are able to check nearly all the new babies virtually or by phone, but our sample said only 30% of them had been seen by someone. And this had a big knock-on effect, I think. It's something else we're exploring. Big knock-on effect in terms of support for new mums. One woman said, my anxiety is exacerbated by lockdown because the regular baby clinics are now unavailable. I don't have regular interactions with health providers to ask questions on a casual basis as they come up. The anxieties build and I doubt myself. And this is the point here really is, for me, is on the casual basis, the scope for informal support around formal appointments was lost. And that meant a lot to women, not just in new mothers either. It came up in our qualitative interviews in relation to mothers doing it for the second time. So a big issue there. However, when it came to supporting children, although most children were at home during the lockdowns, there were some children who were able to go to nursery, but not that many. Although there was, the services were back up and running, the children's centres were back up by July, most of them. Families were very keen to follow the advice. So the advice was to keep children at home if we were able, which we were, since I'm a stay-at-home mum. And most of the families were doing their very best to support their children. And 94% said they read to children at least some days a week, but that was more likely among white families, white British families. 56% said every day. So, and in relation to a question about helping children learn the alphabet, then we can see quite high proportions saying yes, they did. And particularly you can see among the Somali group, 91%. So we're seeing quite difficult living circumstances, but quite big efforts in relation to supporting children. 2 questions. We had a question, open-ended response about worries. And there was a lot of concern. I think 23% of the people who responded to that question were worried about their children's development. So I'm worried about the fact that my 7-year-old son is struggling with reading and writing. And it's difficult to keep my children occupied and safe when everything is closed. My son feeling left out of his friend groups as they were invited back to nursery, but he was not due to limited capacity, and worry about children's learning and falling behind. So although parents were doing their very best. I think there was quite a swell of people concerned about how their children are going to come out of this. And that's been confirmed in our qualitative work as well, of the interviews we've been doing. So the main ways, one of the main ways in which families were trying to maintain themselves during this time was through connection and support. So a lot of our respondents were feeling like they were disconnected. And some of these quotations are from the Bromley by Bow work, things like, we now have 2 jobs, homeschooling and our full-time jobs, extremely stressful and demanding, which if you put that in the context of very squashed space and low income, it becomes even harder. Another one said, supporting my partner through the illness whilst having to provide work full-time and provide childcare, missing my family, particularly not being able to see or look after my mum who's having treatment, missing family and not being able to play their normal roles in terms of kinship was a theme that recurred a lot during the open-ended responses, and it's also coming up in the qualitative interviews. Hard for me to get support or advice from others, which is how I would normally cope, and goes back to the casual moments or the informal support that comes around appointments and around service provision. But quite a lot of people were also saying, I think 30% of people were saying that they've had a lot more family time together and are closer than ever. So you know, there is something to work on there, I think, about how to support family time in the future. And some other worries from the Bromley by Bow work about disconnection, not much connection with community, and fear from unsubstantiated fear-mongering through the media, fear of unknown, feeling strange and lonely in social gatherings. And I think many of us will feel strange and lonely in social gatherings now. So yeah, sorry, relationships with partner. I think, as I said, 27% said spending more time with family was an enjoyable aspect of the lockdown. But 38% said nothing was better. There were no enjoyable aspects of lockdown for them. So, you know, 75% said that they had a good or excellent relationship with their partner, but that was distributed so that some groups, particularly Black, Asian other, white other groups, we had our 7 ethnic groups, were saying that they didn't have such a good relationship. And then we have 2 quotes at the bottom from people who were concerned about the time element and sharing the work with their partner. Buying time for my partner so that I can do more work while he looks after children, a constant struggle. It's mostly me that has to flex to fit in all the work and childcare. And another, coping with a newborn, toddler and teens while trying to explain to my husband I need help. So something we're talking to the borough about is how to support relationships, partner relationships. So really big concern for us is the rate of mental health difficulties in this sample. I think the ONS figure is about 19% have in the country have moderate to severe depressive symptoms, and we've got 31% in this sample, which is a big gap. Much more likely with lower income groups and among Black respondents. And then we have, I think it's only about 40% of the sample had no anxiety symptoms at all. 17% had moderate anxiety. Again, a little bit more among the white groups and Bangladeshi groups and Black groups. So much higher than national rates and a big concern. So the Bromley by Bow work suggests that they've got some top tips for a happy and healthy life and families. And these are all coming across all of our findings as well. So the environment, get out every day and keep active was one of their top tips. Obviously, we are knowing now about increased sedentary time for children being an issue. The environment is extremely important in Tower Hamlets because so few of them have outside space attached to their houses. Play and activities, I think that was the major ask, more time for play and more locations where play can be undertaken that are safe. So that's cleaning up the parks as a number one. Security, building a routine that looks after the whole family. They wanted to see something that looks after everybody, and also that works on the closeness of families that could be there, but also with wider kin. And of course, there is the other side of closeness, which can be dangerous too, but we don't have much data on people who were having a very difficult time in their family. And keeping connections, check in and chat with your support network. And I think that was something that in our interviews, we've seen that is been going downhill. Loss of friendships and loss of contact with people, harder and harder to maintain through phone and video lines. So on the dreams and reconnecting, this was a model produced by the children in the Bromley by Bow work. I think I wanted to say here that reconnecting with people was one of the major challenges that families showed, but there is a long way to go. We've got one father I remember interviewing who was saying he looked up to the window and saw his daughter. He was able to leave the house, so families were coping by fathers leaving the house and mothers staying in the house. Fathers staying in, going out in order to work or to look for work, and mothers staying in and the children staying in. And this father looked up to the window and saw his child staring out, looking like, he said, like she was imprisoned. And he said he felt so bad for her. So there is a long way to dream and reconnect. So I think that's all I am going to say just now. I'm very happy to have your questions as we go on with the day. Thank you.
Thank you very much, Claire. Thanks. There are already some questions in the chat, but I'm going to hang on and keep the questions for the panel at the end, and I'll direct any that are specifically for Claire to her. So thank you very much, Claire. So we're going to move now from that local perspective on Tower Hamlets in London to a rather more national picture from Professor David Taylor Robinson. So David's at the University of Liverpool. He's Professor of Public Health and Policy. He's an MRC clinician scientist and honorary consultant in public health at Alderhay Children's Hospital. And he's co-lead of the NIHR School for Public Health Research, Children, Young People and Families Research Programme. And today he's going to talk to us, it's up on screen, about child poverty, adversity and health across the life course. So over to you, David. Thanks.
Great. Thanks, Kate, and thanks, Claire. And am I in business? Can you all see the slides and everything? Great. So I'm going to talk. I'm going to talk about pathways to inequalities in child health and summarise very quickly what we know with reference to some of our research. I'm going to talk about a period of disinvestment and rising poverty and the impact that had on child health, and show how the opposite. And show how disinvestment has caused an increase in inequalities in child health pre-COVID. Then I'll touch on the COVID situation and what we might do. So this shows the north-south divide in the life expectancy of a child. It shows the green fields of the south, the blood red of the north of England, such that if you contrast the life expectancy of a child born in some of our most affluent areas, this is Kensington and Chelsea, compared to a child born in some of the 10th most disadvantaged areas. For example, Kensington, around the corner from here in Liverpool. There's a gap of pre-COVID, a gap of roughly 10 years in terms of life expectancy, 20 years in terms of healthy life expectancy. These are inequalities in health. We can say a number of things about them. There's nothing natural or predetermined about these differences. They're a consequence of how we structure society. They're profoundly unjust. They demand action across all of society, and we can do something about them. The differences that we see shows what's achievable within a particular context. And we know what causes these inequalities. Inequalities are caused by inequalities in the distribution of the main influences on health, shown here in the Dahlgren and Whitehead rainbow. We could go one step further and ask, what are the processes that cause inequalities in that distribution? But that's for another day. In Due North, we said, to be clear, the drivers of the North-South divide, which are the same as the drivers of inequalities within the borough of Kensington and Chelsea, or within Liverpool for that matter. The differences in exposure to poverty, power, resources needed for health, differences in exposure to health damaging environments, positive health factors, protective conditions, and especially the conditions that give all children the best start in life. We've written a review recently which kind of outlines what we know about the mechanisms that drive inequalities in child health. Do have a look at that. In summary, we know that socioeconomic conditions, poverty, influences outcomes through a number of pathways, through material pathways, through psychosocial pathways, and through behavioural pathways, which influence. We know a lot now about the biological mediators, how poverty gets under the skin, and how that once you're poorly as a child or you have poor development, it impacts your subsequent socioeconomic status as an adult. So we know that children growing up in poverty have more crowded, noisier houses. They grow up in conditions of lower quality. Their neighbourhoods are more polluted. The roads that they live by are more dangerous. We know that the Harvard team talk about toxic stress in families. We know that growing up in poverty leads to, you're more exposed to adversity, to family turmoil, to violence, to instability, chaotic households. And we see these inequalities right from the start. I'm just going to show you some plots that we did a while ago. These plots just show each blob is a local authority. This is infant mortality against child poverty. Clear relationship. The next one shows school readiness, an inverse relationship between the proportion of kids ready for school at age 5 and the percentage of children living in poverty. There's huge scope to improve school readiness across the whole population if we believe the school readiness data. And here's obesity and overweight by age 10, an amazingly strong relationship, almost very low levels of obesity in our most affluent areas, 45% in the usual suspects, Tower Hamlets, Manchester, Hackney, Liverpool, Birmingham, etc. I've shown you some cross-sectional associations there, but we see all of this in the longitudinal data. This is from an analysis of the Millennium Cohort Study, looking at income gradients in kids' outcomes at age 7, especially mental health. Look at the social gradient for poor mental health on the basis of income. Almost no mental health problems in affluent families, up to 25% in kids in the most disadvantaged income quintile. We did a study looking at income trajectories in the Millennium Cohort Study. We looked at whether children were in relative income poverty every 2 years and categorized their exposure to poverty, and then looked at children's health outcomes at age 14. What we found was a dose-response relationship. Every poverty hit increased your likelihood of developing a mental health problem. We also saw that 20%, 1 in 5 children in this nationally representative study in the UK, 1 in 5 children were always in poverty up to age 14. And it was absolutely toxic for all aspects of their health. The effect on mental health was they had 3 to 4 times the risk of mental health, double the risk of being obese or overweight, double the risk of having a long-standing illness. So this shows us what we already know. We know that conditions in childhood are socially patterned, and they cast a shadow over the rest of the life course. We know that these early inequalities track through to influence inequalities in a whole range of costly problems for children over the rest of the life course. So that's a brief summary of pathways to inequalities in health. I just want to show you some data from a study that we've done in Denmark using data linkage, where we looking at adversity and poverty. We followed up 1 million children in the whole population of kids in Denmark between 1980 and 2000, and categorized their experience of multiple adversities, including poverty. These are the dimensions of adversity we looked at. Material deprivation, severe illness or threat of loss in the family, so the death of a parent or a sibling, or diagnoses like cancer in the family. And then we were able to look at aspects of family dynamics, so some of the things that are currently framed as adverse childhood experiences. We looked at children every year in the data up to age 16 and used a group-based trajectory model approach to categorize their experience of those adversities. So first of all, how do those adversities cluster on the basis of income? Well, as you'd imagine, the poorest kids are more exposed to clustered adversities. We then followed them from age 16 onwards and looked at mortality, looked at risk of death in the Danish population. And this is what the analysis shows. This is here, this is essentially a survival analysis from age 16 onwards. This is the background group, the low adversity group. In blue here, you have kids who are transiently exposed to poverty around the time of birth. They have 50% risk of death in early adulthood. These two groups here overlap. This is the high stress group and the persistent poverty group. They have double the risk of death in early adulthood. And there was this group, about 5% of kids in Denmark with multiple clustered adversities. They have 4 to 5 times the risk of death. These kids, now young adults, are dying of the things that you'd imagine in this age group. Suicide, accidents, but also cancers, also. So what does this show us? This shows us that, again, more data that childhood is a sensitive and critical period. Poverty becomes embodied and has impacts over the life course. And I think these data are really worrying for contexts like the UK and like the US. This is in Denmark, where they have much lower levels of child poverty, much greater protection for social protection for families with children. Okay, I'm just going to turn to investment and disinvestment. So it's long been recognised that poverty is bad for children, and we did have targets to address child poverty. We were supposed to have got rid of child poverty last year. That was the plan, on the basis of it was part of the English health inequalities strategy, which some considered to be the world's largest experiment in trying to address health inequalities. We've written about this in this book, which has contributions from Tony Blair and Jacinda Ardern about child poverty. And the English strategy involved a whole raft of interconnected cross-sectoral interventions with a focus on reducing poverty and investing in services that promote children's early development, particularly children's centres. And I haven't got time to go into the data in any detail, but we know that through the analyses that colleagues in Newcastle, Clare Bamborough, my colleague Ben Barr, have undertaken, show that the strategy reduced inequalities, both in life expectancy and in infant mortality. And subsequent to the strategy ending in 2010, we've seen an increase in inequalities. Here's a couple of key slides. In red here, you see increasing inequalities in life expectancy prior to the strategy, decreasing during the strategy, and this kick up, which I'll come to in a second. And you see the same for infant mortality. So this was a period of great investment in children, but then subsequent to the crash, we saw that the gains of the past can quickly be undone. Child poverty started to rise again as the result of policies that disproportionately impacted on families with children. This is one of the many analyses from IFS showing the distributional effect of welfare reform, essentially, showing that the poorest families with children were those hit hardest by welfare reform. All of the changes were regressive, but they impacted children particularly. And these changes happened at the same time as huge cuts to budgets at a local level that support action on the social determinants of child health. Here we have our analysis of the budget when it came out, showing the budget cut by deprivation score. This was Liverpool at the time, the most disadvantaged local authority. Biggest cut, systematically bigger cuts to the north compared to the south. Here are the same data, but calculated as cut per child, plotted against children living in poverty. And we've done a lot of work over the last few years collating the data on spend for children. All of this is available in our place-based longitudinal data resource. And you can look at the impact of those cuts. This is essentially cut to early prevention in children up to 2018 by deprivation score, showing the biggest cuts in the most disadvantaged areas where poverty was rising and where those services were needed most. And so unsurprisingly, we started to see cracks in, we saw a rise in food poverty, a rise in homelessness affecting children, a rise in poverty. And subsequently, we wrote this in 2019, talking about child health unraveling, as we started to see infant mortality, an unprecedented rise in infant mortality in the most disadvantaged areas. We went on to do this analysis, which showed the impact of rising poverty on infant mortality. Using a quasi-experimental approach, we show that about a third of the increase in infant mortality was attributable to rising poverty. And through the School for Public Health Research, we've done a range of analyses showing that the cuts to social protection and increased adversity since 2010 have driven a rise in inequalities in children becoming looked after, a rise in inequalities in childhood obesity, a rise in inequalities in infant mortality, such that we arrive at a situation in Liverpool, where I work, where 40% of children grow up in poverty, a big chunk of kids have poor development by the age of 5, 40% are overweight or obese, and a big chunk of children have mental health problems. These types of trends haven't been missed by the international community. The Lancet wrote that Britain is broken, poor child health proves it. We were visited by the UN, and Philip Alston said poverty is causing misery in the UK and ministers are in denial. And then I know this is about kids, but look, turning to the other end, turning to the life expectancy story, pre-pandemic, life expectancy, the increase in life expectancy that we're used to seeing year on year plateaued, and then life expectancy pre-pandemic was going down, particularly for women in the most disadvantaged areas. These are quite unprecedented trends. We wrote in the Lancet that rises in child poverty, homelessness, food poverty, and a deterioration in mental health have been observed. These have occurred at the same time as a reversal of investment in public services, with the biggest cuts in the most disadvantaged areas. It's time to acknowledge the elephant in the room, the underlying causes of the disturbing health trends in England, and design appropriate policies to reverse them. That was a big public health story. And then obviously we had a global pandemic. And although the pandemic is caused by a virus, the inequalities that it's generated clearly have social causes, and they're the same pathways that I've already outlined at the beginning of this talk. We've written about the pathways to inequalities for both adults and children over the pandemic. And as Claire has outlined, we've seen over the period of the pandemic rising stress for families, rising toxic stress, disruption in protective services in areas that were pre-pandemic ill-equipped to deal with the demands pre-pandemic. And if you subscribe to the life course perspective and the data I've shown from Denmark, this rising stress and poverty will have long-lasting impacts. What do we need to do? Well, we wrote this for WHO last year. In summary, we need to act early, act on time, act together. The whole system needs to be reoriented around children. We need to reduce poverty and reinvest in services for early child development. And just to finish, we've written a number of COVID-related things, and we talked about some of the survey data that's come out over the pandemic. When surveyed about what makes children happy, they continually emphasize the importance of being loved, feeling safe, being listened to. And while they don't deal with finances directly, they stress the importance of having well-funded services and family finances to meet basic needs. And one of the things we're doing in Liverpool in response to some of this, and it's happening in Newcastle as well, is working with UNICEF as part of the Child-Friendly Cities programme to put children's rights at the centre of the policy response. So that's me, over and out. I guess to finish, it's baffling that as a community of people working in child health, we let child poverty wash over 30% of kids in this country. There's clearly a lot more we can do to advocate for addressing that. Thank you.
Thank you very much, David. Thanks a lot. We're hoping to become a UNICEF child-friendly city in Bradford as well. I'm going to be working towards that. As you say, the idea that really we're having to kind of move on this locally rather than our national government wanting to address this at national scale is sad. Okay, thank you to both speakers. We're going to move to a panel now. So I'm going to invite Sophie Wickham and Luke Mumford to unmute their microphones. Luke is lecturer in health economics at Manchester University, and Sophie's a Wellcome Trust research fellow at University of Liverpool. So they're going to join Claire and David in discussion and responding to your questions. So excuse me, I'm juggling two screens here. So if you've got questions for the panel, please post them in the chat, and they're going to be sort of funneled to me, and so I'll be able to sort of pick some of them out. Claire, can we start with a direct question to you from your presentation about why the percentage of your families who are renting plus those who are owning their own homes adds up to less than 100%? What are the categories of housing types of the people who are not included in the figure you showed?
So, yeah, just so for reasons of clarity, we just showed a few options, but there were people in the survey who were in temporary accommodation, who were couch surfing, who were sharing accommodation with friends, and so on. But we just, for presentation ease, just use the two main categories for there.
Thank you. So David, why do you think it is that we don't manage to get the attention we think we need to get to change policy for children, given that across the political spectrum, politicians would say that they are interested in child well-being? What can we do to kind of move the dial on that so that they're not just paying lip service to that, but actually can be brought to sort of recognize the importance of having policies that promote child well-being?
I think that's the key question, really. How do we end up in this situation? I mean, I think it has been, I think I'd describe it as policy failure for children, what we've seen over the last period. I think there has been a failure of advocacy for children, and I think part of that is a lack of voice for children and young people. So I think the UNICEF approach responds to that by trying to make sure that children's voices are captured. And what I'm kind of interested in doing is empowering children and young people to have some of this information, to have a voice in these absolutely critical debates about inequalities. But we've seen that policy can pivot overnight on these things. I think what we're seeing at the moment in the US, you know, they commissioned, there was a huge cross-party review of, what was it called, the roadmap to addressing child poverty in the US, that was funded generously by research councils over there. It outlined the evidence, etc. So it was, and then the new administration have come in and have implemented that. But for me, it's, you know, there are clear moral arguments for doing this. There children's rights-based arguments. The economic argument is absolutely nailed on if you believe the data. It's much cheaper to address the upstream drivers of these problems.
Let's pursue that a bit with Luke, shall we? Luke, if we make an economic argument for addressing child wellbeing, is it a problem because the savings look so unnaturally huge that people just sort of turn away and think it sounds fantastical?
I think that is part of the answer. Yeah, but we know child health is strongly predictive of adult health, and adult health is strongly predictive of economic performance of individuals and of areas. I think one of the key problems for policymakers is that these take such a long time to come to fruition. So a policy now would be really good for child health now, which would then impact adult health and economic gains. But these would come sort of 10, 20, 30 years down the line. And a lot of policy seems to be quick fix rather than long-term investments. And I think that's the narrative we need to play into, to couch this in terms of an investment in the child themselves, which will have its own benefit, but then it can have much larger spillover effects as well and impact everybody in society through a much more economically productive and competitive country or local authority, whatever the level is we're making these investments at.
Thanks, Luke. And Sophie, we have a question about whether we think it's direct effects of austerity and COVID that are doing the damage, or has it been sort of the government reversal of positive things that previous governments were doing? How do we parse out? Do we have any sense of what the biggest causes of current situation are?
Yeah, I think it's a mixture of both of those things. Complete disinvestment in services across the board, but, you know, austerity measures which are primarily, you know, they're fiscally successful, so we've reduced spending, but they've had direct consequences for poverty and health. And the government's main target to move people and children out of poverty is to move parents into employment. But we know that more than 70% of children are in households where somebody's working, so work isn't paying. And if you think about now, we're going to have another recession and the pandemic, work potentially isn't the route out of poverty, and we need to be thinking about alternative measures, particularly social security, and, you know, maintaining the £20 uplift that we've had to universal credit as a bare minimum and extending that to all of the other benefits, you know, is the first thing that I would say that they need to do. Thanks. David's just had his hand up.
David, you had a hand up? Yeah,
I mean, I think we should do some of this as part of the work that we're doing, but the economic argument around, I think, we need to do the sums, but the short-term gains that it's not all about the life course. You know, what we're seeing in looked after children, huge. It's clear that the socioeconomic conditions are driving the rise in looked after children. Or almost all the budget in most local authorities is spent on statutory spend on looked after children. Really poor long-term outcomes. All the inequalities in admissions for children that we see right from the start of life. The fact, again, one of the Sure Start analyses has shown that spending on prevention could drastically reduce those spiraling levels of inequalities in early years admissions for kids. So I think we need to revisit some of the health economics in the early years. Indeed, I know a number of groups are doing that.
Claire, we have a question from a school nurse. Can I move to that one? I saw you had your hand up as well, so feel free to answer more fully. Asking about how, in their profession, they can shift to working proactively, I suppose, in a preventive way, rather than simply working reactively to support children who've got current problems.
I mean, part of it goes back to the spending problem. There isn't enough money to employ enough people on the ground to do the work that moves beyond the reactive to the preventive. Part of it is, I think right now, is taking the plunge and maximising person-to-person contact so that you've actually got time or you inject into any contact that you have with a family, the personal, the humanistic, and the sense that you care about them. And we know from our survey, for example, that even though health visitors were relatively inaccessible, where they were accessed, they were extremely valued by the parents of young children. So it's getting across even the sense of the informal along with the formal, if that makes sense, the ability to communicate in ways that don't just deal with the statutory, but actually move beyond having the sensors out to see what else is happening in this family beyond our statutory responsibilities. But to go back to the policy question, I think last week I had a forum of early childhood education organisations, and we were trying to think the evidence, there is not a problem with the evidence about early childhood education and the importance of it in children's development and the long-term health outcomes. The evidence is not the problem at all, and it's worldwide and it's very consistent. The problem really is a government that doesn't really want to believe it. There's an ideological idea about where children are best placed. So in my view, we have the more demonstration projects that we can have, the actual practice of doing it, of showing that families benefit, rather than just relying on academic evidence is going to be really needed.
So we've got some questions in the chat from various people that are about key policies and at what level we ought to be working to try and change things for children, whether it's national, local, regional, and the kinds of things we ought to be doing, and whether or not the Leadsom inquiry review is going to be helpful. I suspect it will be about as helpful as the race review, and probably just as independent. But in the few minutes that we've got left, can we go around the four of you and can you just tell us, you know, like if you were in charge, and it could be at any level, national, local, regional, what key policy would you put in place for promoting child development, child well-being, reducing inequalities? What's the first thing you would do if you were given the power to effect a change? I'm going to start with Sophie.
Thank you, and apologies for the child in the background. I think without focusing on child poverty, so thinking about maybe not calling it universal basic income, but looking into things that will actually lift people out of poverty. Universal income is one aspect that I would want to explore, certainly.
Thank you. We've got local authorities all over the country are actually asking national government to do pilots of universal basic income trials in their areas. So maybe we'll see some shift on that. Claire.
Well, I think the opportunity and the experience is there that shows that universal, freely available early childhood centres for everybody, every child, has the best chance of equipping them and for their enjoyment and their learning and the child and their parental protection. And that if I was in charge, I would then have a network of early childhood education centres across the country.
We had a little go at that previously. Let's do more of it again. Yeah, let's do it again. Luke.
I completely agree with Claire. I think I've reversed the cuts to Sure Start and actually really heavily invest in those type of centres, because in the past we saw that they were highly effective, and particularly in the communities where they did have the biggest scope to benefit, and the cuts in them have been shown with reverses in those trends as well. So if we get that back and go further than we did before, I think that would be a really good place to start.
Thanks, Luke. And David?
Yeah, I think we've got this natural experiment. We were kind of doing all right throughout the English health, we'd set up this infrastructure. Yoko Ono opened a children's centre just down the road here at the school John Lennon went to, and we've spent the last 10 years trying to keep it open because there's no money. It's clear what we need to do to address child poverty. It's reverse some of the, we need to make sure that the uplift on universal credit is maintained, the benefit cap, the 2-child limit, the bedroom tax. Analysis shows that those have directly driven a rise in child poverty. So it's clear what policies need to be addressed. And then locally, these are small sums of money for investing in children's centres, really small sums of money in the big picture. We just need to shift some of it.
Yeah.
So I think it's nice to see a child on the call. Yeah, it focuses our minds on what we're trying to do here.
Yeah.
So, you know, we're having it pointed out to us that universal basic services or unconditional basic income, Sure Start programs, and that we know all of this. So, I mean, I do feel very much that, you know, having been working in this field for decades, you know, we all know what we're doing and we all know what the root causes are, and we all know how to change things, how to move the dial for children. And it is that struggle, isn't it, between trying to get attention and trying to get beyond the ideology that sets up barriers. And, you know, all of this past year, we've heard our government talking about listening to the science. And I think we need them to be listening to a much broader range of science, including the sciences underpinning public health and child development, and understanding the social determinants of health and child well-being. We are at 1 minute to 3 p.m. and I know that everybody has very, very busy schedules these days, and it's a problem if Zoom calls go on a long time, and certainly beyond when they're scheduled. So I think we should end now by thanking our speakers for their time, reminding you that we will be making the slides, the presentations and the recordings available. And so you will be able to look at those later. And I think, yes, there's also a Twitter feed on here, so you can follow discussion. So it just remains to me to thank Claire, to thank David, to thank Luke and Sophie for giving us their time this afternoon, and to thank so many of you for joining and putting your questions in the chat. I'm sorry we couldn't get to all of them, but if you use that Twitter feed, we can maybe get some discussion going on Twitter or other social media and keep this conversation going. So thank you very much for joining us this afternoon. And speakers, if I can ask you to just stay on a few minutes, that would be great. Thanks very much, everybody, and enjoy the rest of your day.